Well, I often talk about woke dysfunction on this channel and how it's infested every institution in the West and how it's bad for you, both mentally and physically. Case in point, from the postmillennial, Montreal doc suspended for referring to transitioning woman as female. Well, geez, I hope he didn't let slip that the storks don't actually deliver babies. I mean, that could be super triggering, right? And boy, he really wouldn't want to tell her that the prostate exam isn't necessary when the prostate is imaginary. The provincial administrative and disciplinary body criticized Dr. Raymond Briere, a Montreal physician who has been practicing medicine for 40 years, for allegedly wielding, quote, an inappropriate and disrespectful attitude towards a patient whom he called a biological woman. So he called a biological woman a biological woman. Have I mentioned woke dysfunction yet? Because when a doctor can be suspended for just knowing the most basic biology, well, you've got a system that's dysfunctional at that point, and one that patients have just absolutely every reason to distrust. Because at least in this case, they're not practicing medicine, they're practicing magic. Let's see, apparently this patient met with the doctor in May 2022 to discuss injecting hormones to appear more masculine. The woman secretly recorded the conversation. So that's interesting. The ruling stated that the patient expressed a decision to, quote, move on to the next stage in their transformation, which is hormone intake. The woman had decided to change her gender a year before, but had only changed her pronouns. Briere was reluctant to comply with his patient's demands, not wanting to rush into hormone therapy, and because he had, quote, little experience with trans people. So he's opting for caution in this case, because he said he had little experience with trans people, which just seems to be the responsible thing to do, wouldn't you say? So it seems like his true blasphemy here is not just immediately complying with the affirming model. And what is that? That states that you must simply just accept somebody's self-diagnosis. They say, I'm this now, and the doctor has to just say, great, here's some drugs. I mean, literally, the standard is that people now self-diagnose themselves. And if it's something to do with gender, you just have to go with it. And any concern for possible other underlying causes for their self-diagnosis is called transphobic. Kind of seems like the opposite of what doctors should be doing, right? Well, the doctor warned the patient about the potential adverse reaction of the body to hormone treatments, noting that male hormones can increase aggression. So it looks like it's true that he doesn't have much experience with these treatments because it does a lot more than that. Let's see, the safety concerns of testosterone therapy include the potential for developing hirsutism, acne, behavioral and personality changes, breast cancer, endometrial cancer, hepatotoxicity, and potentially detrimental effects on cardiovascular health and bone health. So, that seems like kind of serious stuff, but apparently Briere's advice was dismissed by the transitioning woman. Well, I guess it's true when they say the customer's always right. So let's see, Briere said he had never prescribed hormones to a person who wants to turn into a man, and suggested the patient might find benefit from talking to another doctor who had more experience in this subject matter. See, as a patient, that's the sort of thing you should say, okay, I think you're right. Maybe I should talk to somebody who has more experience in this. That would seem like the sane thing to do when you're talking about, permanent changes to your body and potentially very serious adverse effects. It almost seems like in Canada now, it's the sane, responsible people who get punished. So let's see, I guess they discussed using some testosterone gel, and Briere responded by noting that females can utilize a pump to apply testosterone gels. His patient insisted this procedure wouldn't apply since she now considered herself to be male. And I guess here he really offended wokeness by simply telling the truth. He said, quote, you are a woman, dear lady. If a chromosomal analysis is carried out, it will be shown that their chromosomes carry XX genes, not XY. Briere continued, saying that the patient's male identity only existed, quote, in your brain. Fact check, true. Now, this isn't to say that people shouldn't be allowed to pretend there's something that they're not. I just think that we've reached peak lunacy when you're forcing doctors, medical professionals, to pretend to believe things that they know are not true. But such is the state of medicine in Canada right now. I mean, here's an article from December 2nd, 2023 by Conrad Black talking about Physicians College embraces social justice lunacy. This authoritarian nonsense puts Western civilization at risk. Says one of the most absurd and alarming indications of the disintegration of contemporary society is the recent revelation that the Royal College of Physicians and Surgeons of Canada has set up a study group whose purpose is to give what it considers to be suitable weight in professional medical training to questions of social justice and avoidance of racism. It is difficult to imagine what outright lunacy must have possessed the authorities of that venerable and most necessary learned profession to embark upon such an insane enterprise. Well, it's because they're cult members, and if they're not cult members, they're afraid of the cult members. So let's take a look at what he's talking about here from CanMed's Equity, Diversity, Inclusion, and Accessibility Interim Report. It says CanMed's 2025 affords us the opportunity to think critically and propose a vision for the practice of medicine, which is rooted in, you guessed it, social justice. And we have to remember that whatever they're saying is the opposite of what it actually means. So social justice means social injustice. Anti-racism means racism. Anti-oppression means oppression. Let's see, cultural safety. Well, we know that means cultural danger. Promoting a broader cultural shift, which is necessary for the profession. And why is it necessary for the profession? Well, there's no argument here as to why. It just is. This is praxis. This is social justice praxis, where everything they produce just assumes that Canada is a racist, oppressive, patriarchal, systemically racist society. They start with that as the foundation and just go from there. Truth, reality be damned. This is just so utterly absurd. It's surreal actually seeing it. As a profession and healthcare system, we participate daily in the perpetuation of structural violence. I had no idea there was all this structural violence going on in Canadian healthcare. What is structural violence, by the way? Spoiler alert, it's not actually violence. But anyway, upon the most marginalized among us, particularly those who are racialized. Who's doing the racializing, by the way? You know who's doing the racializing? The left. They're the ones who made up the word, and they're the ones who are obsessed with race in everything. They're the ones who say that your skin color, your immutable characteristics actually are the most important thing about you. See, that's what we used to call racism. Now they call it anti-racism because they're lunatics. But anyway, let's continue and live at the intersections of marginalization. Oh yes, those intersections of marginalization. I think I got some tacos there once. Because of our race, ethnicity, religion, sex, gender identity, social class, ability, immigration status, and more. And I think when they use the word our there, they're not talking about all of us. Because, somebody has to be responsible for all that marginalizing and that structural violence. And that person probably looks like a lot like Justin Trudeau, actually. Although I'm sure that they consider him one of the good ones. But get this here. A new model of CanMeds would seek to center values such as anti-oppression, anti-racism, and social justice rather than medical expertise. So there you have it. There's the end game. Anti-science versus science. Lunacy versus sanity. Equity versus equality. And ultimately, dead instead of healed. All for social justice. Because, if you want just an insane, dysfunctional medical system, this is exactly what you would do. This is called Sovietizing it. You would take an ideology that ultimately only cares about a fictional oppressor versus oppressed narrative over, as they say here, as they actually say in this, medical expertise. And of course, this all flows down from the top. Justin Trudeau has given permission to the worst excesses of the woke cult. And you can be certain he would approve of all of this. And it's just another reason why he's got to go as soon as possible. In the meantime, I'm sure the Physicians College is eagerly looking forward to bringing back bloodletting and leeches. Anyway, that's all I got to say about that. Please subscribe, like, and share. Sharing really helps me out. I thank you for doing that. I will see you next time.